Every guy wonders this at some point. Is mine normal? What does a healthy penis actually look like? And what should you be concerned about? Today we're breaking it down simply and clearly, especially for men over 50. Hey, I'm Dr. Zoe Hartley. This channel is here to help men over 50 with real questions about health, aging, confidence, and yes, even what's going on below the belt. No shame, no judgment. Just facts that can help you feel more at ease in your own skin. 1. Skin texture and color. Skin on the penis can range from light to dark brown, pinkish, or even slightly purplish. It's often darker than the rest of your body, and that's normal. Minor visible veins, wrinkles, or folds. Also completely normal. 2. Shaft appearance. The shaft may have some hair at the base, visible veins, loose or tight skin depending on temperature and arousal. As you age, you may notice less firmness, but that's not unhealthy unless it affects function. 3. The head glands. The glands or penis head may be smooth, slightly shiny, and sensitive. Circumcised men may have a drier appearance. It's normal to have a ring or ridge around the head, called the corona. A slit opening at the tip for urine/semen. What's not normal? Redness, pain, open sores, or discharge. 4. The frenulum. This is the thin, sensitive strip on the underside of the head. For most men, it's one of the most sensitive parts. Completely normal to feel tenderness there. 5. Bumps and folds. Normal bumps include Fordyce spots, small white/yellow glands, pearly penile papules, tiny white dots around the head, hair follicles at the base. These are harmless. Warning signs: painful sores, lumps under the skin, or warts. Get checked if you see those. 6. Size and curve. Most penises curve a little to the left or right, totally normal. Also remember, size varies greatly, and the average erect length is about 5.1 to 5.5 inches. A healthy penis isn't about length. It's about function and comfort. 7. Erections and ejaculation. A healthy penis should get firm with stimulation, go soft after, ejaculate normally. Changes over time? Totally normal. But sudden changes, pain, or blood? Call a doctor. Call your doctor if you notice persistent pain, lumps that grow, sores or rashes that don't go away, discharge or foul smell, pain when urinating or during sex. Early checks equals peace of mind. So what does a healthy penis look like? There's no one shape, color, or size, but there are clear signs of good health. The more you know, the more confident you'll feel. Like this video if you learned something helpful. Subscribe for more real, honest answers about your health after 50. Next, check out Why Do Painies Feel Pain? For a deeper look into what's okay and what's not.